Hello friends, welcome back to my channel. Today I'm going to discuss with you regarding the reading part A. Reading part A consists of 20 questions. So 15 minutes are given to us for solve these questions. Okay. Before moving towards the question side, I will tell you some main tips to use for OET reading part A. Well, first tip is focus on the keywords. So like this, text A, text B, and text C and text D is given. So first tip is focus on the keywords. So let me tell you what are the keywords in text A. Like this, dry eye syndrome is a chronic lack of sufficient lubricant and moisture on the surface. Like these medical terms are the keywords. We can underline these keywords during our reading part A. Reflex tears, okay, any number is mentioned or like this type of like this bracket one is very important, and after that move toward text B. Here are also normal films, three components, main three components, all these we can underline this and also these points. Okay. So these will help to find out like this bracket one, inverted comma. Okay. Now moving toward the text C, and text C is like the first is the heading part, headings, subheadings. We can read this also. These are the main points which we can most of the questions are from this part. Okay, then medication. Okay, so these are the focus on the keyword. Okay, next is predict answer. So when we read the question, we can also predict our answer. And one more formula, as I've already tell you in the last video, that while doing reading part A, mention here A, B, C and D. And in these paragraph text which are given, we see that first is the definition. Okay, first is the definition, and the second one is the types of tiers, three components, and these are all the types. And the third part is the test or investigations. Okay, evaluation means. Okay, and the fourth one is the medication. Well, so this is also very important and easiest formula to find out the from the text. Okay, so moving towards the first question, as it consists of total 20 question. First 7 is the match the following. Okay, so first question is, in which text can you find information about? First question is procedure for medicine intake. So guys, see, here is medicine. So we can predict that medication is in the text D. So we can directly write D here. So answer is D. Okay, because see here, text D is medications. So the answer is D for question number 1. Okay, next is, what do symptoms do you find while assessing? So here the answer is C. C1 is the evaluation, so it's not the answer. D is the medicine. Okay, so not the answer. And A1 is the definition, so it's also not the answer. So the answer is B. So because all the symptoms and all important components and this stir instability, all these are given in text B. So the answer is B. Next is providing conformity of the syndrome. Or conformity means confirming. So from the investigation or tests or from evaluation, it's a synonym of evaluation. So it's easy to go directly to text C. So the answer is C. Okay. So this is the way and this is the points, main keywords we can use to attempt part of reading. Okay, next one is administering the prescribed medicine. Again, here prescribed word is there, medicine is there, so we can directly go to text D. Here medications, all the medication, see prescription is also mentioned. So for answer 4, the answer is D. Okay, without reading we can directly write the answer. See how easy it is. Then fifth one is reflex tears are triggered. So reflex tears we have read in paragraph A, here heading. So that's why I am saying that read headings, subheadings, because these are very important, okay, for part A. Next is question number 6, that is performing detection mechanism. So detection is again evaluation. So we can directly go to part text C. So the answer is text C again. Okay. Then next is why tears are produced. So see all this regarding tears, definition and all things are mentioned in tears are produced like this. The water type that produce in the response to injury and all. These are all mentioned in this paragraph. So we can write here in question number 7, the answer is A. Okay. So like this you can do the match the following questions. Okay. Next, we can start with question number 8 to 14, that is the answer each of the questions 8 to 14 with a word or a short phrase from one of the text. Each answer may include word, number or both. Well, the first question for 8th question is why cornea of eye need tear continuously. So we can directly go to paragraph A because all the definitions is mentioned in paragraph A, and the answer is protection against, here I have seen here the cornea which covers the front of the eye need tears continuously, what, to protect against it लिखने की जरूरत नहीं, protection against infection is the answer. Okay, so protection against infection is the answer. Okay, next is tear stability can be confirmed with, again confirmed means evaluation. Okay, so we can directly go to text C and the answer is C, tear stability. Here point second. Okay, so the test which is used to confirm is invasive BUT or non-invasive BUT. So directly we can copy from the paragraph. Okay, invasive BUT hyphen non-invasive BUT. Okay, like this we can search the answer. Next question is what need to be taken in order to reduce eyelid. Okay, so for this what need to be taken, something that is used to reduce the, okay, so the answer is here directly go to the paragraph D. Okay, paragraph D. So for this we can search here eyelid inflammation, to reduce eyelid inflammation. Inflammation along the edge of your eyelid can keep oil glands from secreting oil into your tears. Your doctor may recommend antibiotics to reduce inflammation. Antibiotics for dry eyes are usually taken by mouth. Okay, so what is used? Antibiotics. So answer is antibiotics. Okay, so right here antibiotics. ठीक है. Next is what will be produced by meibomian glands? So for this, we can directly go to text B, because here is main keyword meibomian gland. Okay, so for this we can search what is produced. Okay, so the answer is oil component is, here is also meibomian gland. Oily component is produced by meibomian gland. Okay, so here in two places meibomian gland is mentioned. Okay, but our question is regarding produced. Okay, so the answer is oily component. Okay, so right here oily component. Next is, when can you determine of reflex tears are caused? So for this we can reflex tear we have read in paragraph A. So directly go to paragraph A, and the question again, see, when can you determine of reflex tears are caused? When, that is something kab. Okay, so that is the answer is here reflex tears, the water type that produce in respond. So that is when means in respond to, answer is injury, irritation or emotion. Okay, so this is the answer, injury. So the answer is irritation, injury or emotion. Okay, next is question is, what kind of syndrome it is when there is lack of adequate quality of tear? So syndrome we can find, now we can find what kind of syndrome. Okay, so when there is lack of adequate quality of tears, so directly go to paragraph text A, because syndrome is mentioned here. See, here is syndrome, and used to emphasize that inadequate quality of tears can be just as important as inadequate quantity. Okay, so the answer is dysfunctional. So the answer is dysfunctional tear syndrome. Okay, next is what is recently identified in causing eye syndrome? So recently identified. So here for this we can directly go to B, because dry eye syndrome is mentioned in text B. Okay, so here is the answer for this, because see, dry eye. Okay, the underlying condition called meibomian gland dysfunction is now recognized as a significant factor in many cases of the dry eye. So recently means now, identify means recognize. So see, these all are the synonyms we used. So that's why we can directly go to here. So the answer for this is meibomian gland dysfunction. Okay, so this is the answer. Directly pick this answer and write over here. Okay, meibomian gland dysfunction. Okay, next is 15 to 20 questions. 15 questions. Before that, I will read this. Complete each of the sentences 15 to 20 with a word or short phrases from one of the text. Each answer may include words, number or both. Well, question number 15 is, tear stimulating drugs are prescribed by doctor for tears. So see, here it is regarding the prescribed medication drugs. So for this, it's easy to move towards the text D because medication is mentioned in text B. Okay, so for this we can search now the answer for 15. Tear stimulating for tears um, tear stimulating here tear stimulating drugs. Okay, so for this drugs called cholinergic help increase tears production. So answer is tear production. Okay, like this we can search that. Now the next question is question number 16. Lysosome and lactoferrins are used in dash type of evaluation. So type of evaluation is the keyword. So in text C types of evaluation. Okay. So this test is mentioned here. Electrolytes, protein, lysozyme and lactoferrins. Okay. So the answer is chemistry. So used in chemistry. Chemistry. Okay, chemistry is the answer for this question. Okay. Next question number 17. Dash help in preventing tear film from evaporation. So tear film we have read in paragraph in text B. So here text B, question number 17. Here evaporating and tears. Okay, each component of the tear film serves a critical purpose. For example, tear lipids help keep the tear films from evaporating too quickly. So this is from the question and answer is tear lipids. Okay, so tear lipids help directly. Same from the text we have to write here. Okay, next one is 18 question. Mucin component for covering white of the eye is produced by dash. So is produced by this we can go to text B again. So main is mucin component. So here is this component mucin component. So mucin component is here is produced by goblet cell. So the answer is goblet cell. Produced by goblet cells. Next is 19 question. Lacrimal gland producing the watery component located in the dash eyelid. So watery component. The watery component is second one. Okay, watery component. So here is watery component is produced by lacrimal gland located behind the outer aspect of the upper eyelid. So upper is the answer. Which eyelid? Upper eyelid. Okay. And the last one is 20th question. Dash are not ideal eye drop used for dry eye syndrome treatment. So eye drop is a medication. So we can go directly to text D. Okay. Text D and eye drops here. Second point. Eye drop to control cornea inflammation. So the answer is corticosteroids, as corticosteroids are not ideal for long-term use as due to possible side effects. So corticosteroids are the answer. So well, we have finished with the 20 questions. So guys, I hope you understand this video and teaching. Thank you for watching my video. Thank you once again.